Blood pressure measurement is one of the most important recordings in healthcare. Normally, blood pressure is measured non-invasively from the upper arm using a stethoscope and a pressure cuff. With modern equipment, it is possible for a patient to measure their own blood pressure without assistance. In surgery, and when a patient is in intensive care, if it is anticipated that blood pressure will change rapidly and dramatically, the only way of measuring the pressure is direct continuous monitoring via arterial cannulation. This video shows the arterial cannulation procedure from the nurse's point of view. It is the nurse's duty to prepare the patient and the equipment for the procedure and to assist the doctor if needed. The nurse also records the procedure and monitors the patient's condition throughout the whole procedure. The arterial cannulation monitoring pack consists of tubing and a sensor. Additionally, a pressure bag and an infusion fluid will be needed. After opening the package, the nurse will check all the tubing's connections. The pressure pack is connected to the infusion bag as normal. The tubing is filled with the fluid by pressing the sensor's valve. The infusion bag is connected to the pressure bag and the pressure is pumped to 300 millimeters of mercury to prevent blood from rising into the tubing. Finally, the tubing is checked for air bubbles because they can adversely affect the measurement. The fluid in the tubing transmits the pulse pressure to the membrane of the sensor. The sensor converts the membrane's movement into an electrical signal, which is displayed on the monitor. The patient is identified by asking them who they are and checking the wrist's identification band. He or she will also be briefed about the forthcoming procedure. The World Health Organization pre-operative checklist is read by the staff of the operating theatre. This checklist has been developed to improve the patient's safety, and the list is read before every anesthesia or any other procedure. The patient's notes, particularly with reference to their previous medical history, medication, allergies, and fasting status, are double-checked. The completed anaesthetic and operative preparations, and also the operative and anaesthetic risks, such as hemorrhage or difficult intubation, are noted. Completing the checklist takes only a few minutes, and it has been shown that it reduces complications by as much as 30%. Moreover, it ensures that the staff are more involved and engaged in the procedure. The site for the puncture depends on the operation, possible arterial disease, and previous arterial operations. The most common site is the radial artery. The other possible sites are the femoral, brachial, and axillary arteries. If the cannula is to be inserted into the radial artery, an Allen's test is needed before the procedure. This test will confirm that the blood circulation of the hand remains sufficient even though the radial artery would be occluded due to the puncture. Normally, the blood circulation of the hand is secured even though one of the hand's two main arteries is lost, because the main arteries unite at the hand, forming the so-called vessel arcade. However, it is possible that the blood circulation of the hand will need both arteries. To perform the Allen's test, the doctor will lift the patient's hand upright and ask him or her to make a fist. the doctor compresses both main arteries to occlude them for about 30 seconds and asks the patient to open their fist. Now the blood circulation of the hand is cut off and the hand becomes pale. The doctor then frees the ulnar artery, keeping the radial artery still occluded. The colour of the hand should return to normal. The conclusion is that the ulnar artery circulation alone is sufficient for the hand and the radial artery can be cannulated safely. In this case, the cannula will be inserted into the radial artery. The patient's wrist is hyperextended and a pillow is put under the wrist for support. The patient's fingers are taped to the table to fix the hand in place. The puncture site is cleaned extensively according to the recognized protocol for operative skin cleaning. The cannulation of the radial artery is done by the anaesthetist. To do this, he first feels the arterial pulse with his fingers. The pulse can also be identified with an ultrasound machine specially equipped for this procedure. According to the latest studies, ultrasound guidance improves the success rate of cannulation. The anaesthetist pushes the needle with a sharp movement through the vessel. He then draws the cannula back until blood squirts from the needle. The cannula is inserted slowly into the lumen of the vessel. The pressure sensor is set at the same level as the patient's heart. The tubing is connected to the arterial cannula and the pressure sensor to the monitor. The valve of the cannula is opened and the blood pulse graphics and blood pressure reading will appear on the monitor screen. Zero calibration is performed by turning the sensor's knob to 0 and pushing the monitor's calibration switch. It is important to ascertain that the monitor's reading reaches 0. After the procedure, it is the nurse's duty to watch the patient's general condition and the skin around the cannula. The nurse also monitors the pressure of the pressure bag and fluid levels.
No niin, eli se mitä siis nyt tapahtuu on se, että ensin irrotellaan tuosta nuo teipit pois. Sen jälkeen siinä on molemmin puolin yhdet ompeleet. Poistetaan ne ompeleet ja sitten tää kanuli vedetään irti ja painetaan sitä. Kun se on valtimossa, niin sitä täytyy jonkun aikaa painaa, että se vuoto hyytyy. Siinä se kaikki. Eli ompeleiden poistoa varten veitti, steriilejä taitoksia ja sitten kuffillinen rannehihna painamista varten. Joo. Näytöltä pois tuon verenpaineen, että kun minä mun sulkemaan tuon, niin se ei näytä vääriä verenpaineita. Joo. Suljen tuon kanyylinkin tuosta. Sitten minä alan irrottelemaan näitä teippejä. Osa voi olla vähän tiukassakin, että nyt ihokarvat kyllä lähtee sitten. Niin, nyt minä poistan nämä ompeleet täältä. Pikkusen joudun nostamaan tätä ommelta, niin saattaa ihossa vähän tuntua. Noin, nyt on ompeleet pois. Jonka jälkeen minä vain vedän tämän kanyylin tuolta ulos. Minä paan tuommoisen remmin, jossa on sitten tuommoinen tyyny, ilmatyyny, mikä ruiskulla täytetään ilma, niin siihen tulee just siihen pistokohan kohdalle semmoinen ilmatyyny ja se sitten pitää sen valtimon sulettuna siitä ja sitä sitten pikkuhiljaa sieltä. Hyvät on verenpaineet. Tämän takia sitä täytyy painaa, että se vuoto loppuu. Noin. Nyt se täyttyy tuo. Tunnetko, kun siihen tulee paine? Joo. Onko kova puristus?
No ei se vielä oikein kova.
No. Sitten hetken päästä voidaan jo löysätä. Nyt sä voit ihan normaalisti sitä liikuttaa sitä kättä.
Joo.
Ja se oli siinä.
Kauanko sitä pidetään?
Maksimissaan puoli tuntia. Puolen tunnin päästä viimeistään pitää löysätä, mutta kyllä ne yleensä tuossa 10-15 minuuttia sitten ruvetaan katsoa vielä, kun vuotaa.